Hi there, I'm James Roback, Director of Marketing and Sales for Utica Dental Laboratory, and this is 5 frequently asked questions about dentures. Number 1, do I need to see a dentist in order to get a denture? We get this call every day from patients who are in need of a new denture or a repair. You absolutely do need to go see a dentist in order to receive a denture. Dentures are classified as medical devices, and you need a prescription written by a licensed dentist or a denture clinic if you're in a state that has them. A dental lab is not allowed to work directly with patients. And I understand the reason for it. I'm a do-it-yourself type person too. If I can cut out the middleman, I'd rather do the work on my own or go direct to the source. But there's a good reason. There's good reasons to go to your dentist anyways, particularly if you need a denture. If you're at the point where your teeth are loose or falling out, there's probably a significant amount of tooth decay that can lead to abscesses, inflation, pain, infection. If left untreated, it could even lead to your death. So if you're at the point, if you're losing teeth, an exam would be beneficial. Also, I know there's a lot of people who hate going to the dentist and hate being told what to do or what not to do. And I try not to judge anybody, but if you're a smoker, one of the leading causes for why people need dentures is because smoking causes damage to the teeth and gums. And a dental exam can help catch early signs of certain types of cancer. Having had family members both pass away from cancer and recover from cancer, catching it early makes all the difference in the world. So see your dentist. Almost all causes of tooth loss can be eliminated by brushing, flossing, and seeing your dentist at least once a year. Number 2, what is the process for getting a denture? The process for getting a new denture is about 4 or 5 steps, depending on your dentist. First thing that's done is an impression is taken of your mouth, of your teeth, if you have any left. We make models in the dental lab. We'll make stone models, cast them, and then we'll return what's called bite blocks or wax rims. Your dentist will use those to get the vertical dimension centric relations so that we have an understanding of how your teeth, how much space is in your mouth. Once we have that, we will build a wax try-in with the denture teeth so that we can get an idea if it fits. That your dentist will make adjustments to that try-in to make sure it fits well before returning it to us, where we will then make the final apparatus via press pack with Lucitone 199 acrylic and Arctic teeth from Calzer. There is the potential for an extra step if your dentist opts for custom trays. In that case, we make trays that fit more snugly to your mouth, can help improve fit, but not necessary if the standard size trays happen to fit you just fine. Number 3, should I need to use Fixodent or Poligrip to keep my denture in place? The short answer is no. Your denture should fit on its own. You can use something like Poligrip in a pinch. If you have something going on or you can't get to the dentist immediately, but repairs can be made to your denture even if you're completely dentulous, even if you have no teeth at all. Your denture should be fitting and staying in place. If you've had your denture for a while, it's possible that a repair needs to be made. Reline dentures do wear down over time, but you shouldn't really need any sort of aid to help keep it in place. If you just recently received a new denture and it slips around in your mouth, then you have a ill-fitting denture and an even worse dentist for letting you walk out with that. But as I mentioned, they will wear down over time, which leads us to the next question. Why doesn't my denture fit anymore? A couple reasons, potential reasons for this. As I just mentioned, denture wears down, needs to be repaired, but your jaw will also wear down over time as well as you use a denture. The actual jaw bone, you'll actually have bone loss of your upper and lower jaws over time. It's unavoidable if you're using a denture. So every 5 years or so, you'll likely need to replace your denture, either because of wear on the denture itself or because they no longer will fit your mouth. Your mouth will transform. Each progressive denture that you receive is going to be a little bigger, a little bulkier, As you lose bone, you need to add more material. But there are also some cases where a few repairs can be made, and usually that's done the same day by the dental lab. So see your dentist if your denture isn't fitting. You can use Poligrip aids like that for a short while, but extended use is really not recommended. And if you continue to have issues with your denture not fitting, then consider finding a new dentist. Number 5, can I make adjustments myself? I suppose you can in theory. I like to tinker with things myself, try to fix them on my own if I can. So I understand the urge to do that, but you really shouldn't. You can do some serious damage to your denture, which can have long-term effects on the comfort of your mouth, lead to sores, cause irritation, and also if your denture breaks, any kind of over-the-counter glue or adhesive you use, is likely going to be toxic for you, or not something that you want to have in your mouth. Food safe. See your dentist. Repairs are typically made in a day or less. And we'll get you right back. Turn around and ready to go. So that was 5 frequently asked questions about dentures. I'll be back soon with 5 more questions regarding dentures and the dental technology industry. But until then, so long for now.